President Cyril Ramaphosa says that South Africa will soon receive its first consignment of COVID-19 vaccines from the Serum Institute in India, the world's largest vaccine producer. In his weekly letter, the president said that that will signal the start of a mass vaccination campaign. The first vaccines to arrive will be provided to healthcare workers. The second phase will include essential workers, teachers, the elderly and those with co-morbidities. And the third will include other adults in the population. Let's bring in Professor Alex van der Heever, a chair of social security at the Wits School of Governance, and Sasha Stevenson of the Health Rights Program at Section 27. A very good evening to you both. Thank you very much indeed for joining us. Prof, let me start with you. So in our previous conversations, you've already said that government had been incredibly slow in this process. Does there appear to be a clear strategy at all on the rollout?
No, there isn't a clear strategy at all. I think that they've largely started looking at it from the second week of January, and that really puts us behind because the rollout strategy is potentially quite complex, should involve both public and private sector platforms, and should probably be largely decentralized in how it operates, but have a number of important factors that need to be coordinated at a national level. I've seen no documented strategy outlining this, and I doubt we've got a clear plan at this stage. It might be information, but usually if there's no documented plan, it means it's not properly thought through yet.
Yeah. In the president's weekly letter, he said that the country will soon, I quote, receive its first consignment of COVID-19 vaccines. But Prof, logistically, wouldn't this need to also happen quite fast? Or else, if it's not sufficiently rolled out, at least by winter, we could risk a resurgence.
Yeah, so firstly, the 1.5 million doses doesn't completely cover our frontline health workers. We needed about sort of 1.25 as sort of crude estimate, 1.25 million. That means we needed about 2.5 million doses. We only have 1.5 million, so that's the first problem. The second problem or issue is that most of the frontline health workers who are at risk are on medical scheme, and probably that meant that the rollout strategy should have involved the private sector. There's no idea of that and how fast it will take. And then phase two is quite critical because it involves all the people who could develop severe illness or are equally at risk in terms of exposure to transmission as frontline health workers, such as teachers, as well as people with comorbidities. So we are very likely to have a third surge going into April, May. So if we have not got a vaccine that is sufficiently rolled out through then, we're going to have mortality rates equivalent to what we're seeing now.
Prof, I'll speak about that very shortly. Ms. Stevenson, let me bring you in there. What is Section 27's view on the rollout plans to reach all these communities?
Well, I think, as Alex has said, there hasn't been sufficient detail in the public domain about what those rollout plans actually look like. You know, there was pressure for the department to come out with its vaccine rollout plan. We saw the beginnings of a plan, and that was certainly to be welcomed. But we don't have enough information about what rollout's actually going to look like. And importantly, we haven't had participation of healthcare users, of researchers, academia, civil society in the development of that plan. And the reason that that's important isn't just because people like to be involved in the production of plans, but it's for reasons of acceptability. It's so that people understand what is happening. They understand where they are on the list and why the plan why vaccine should be rolled out to them at a particular time. And of course, there's also a constitutional requirement for there to be participation in government policy and plan making. And so I think it's really important that government starts bringing South Africans, people living in South Africa, into its confidence, and starts allowing the participation of people across the country in the production and indeed the implementation of plans. Because as Alex says, this is going to be a huge logistical undertaking, and it can't just be done by government.
Ms. Stevenson, then what role should the private sector and business play then in the distribution of this vaccine?
equitable
Well, what the vaccine rollout strategy, such as it is, says is that vaccines will be rolled out across both public and private sector, but the procurement will happen centrally.
Yeah.
So that the vaccines will be procured and will then be sent into either the public sector or the private sector to be distributed as such. Now, it's important, as Alex says, that both public and private sector are involved in rollout. It's also really important that we focus on equity in the rollout of vaccines, because what South Africa is very good at is perpetuating inequity. And if we have a situation where the private sector is able to vaccinate large swathes of private sector population before more at-risk populations in the public sector, that'll be a huge problem, both for equity and for herd immunity. So while there are significant problems in the way that the rollout plan is formulated, the principle of equity is an important one.
That rollout plan, Prof, starts off, of course, with high risk. And another high-risk community is the mining sector. They're not included in the priority groups from what we know now. Should that be of concern at all?
Yes, it should, because I think that the mining community itself is involved occupationally in a very high-risk activity in relation to COVID, because if you're in a mine, you're in a poorly ventilated space, very closely crowded with other people. It's very difficult to breathe with masks. And we've got essentially hundreds of thousands of people in this and their families. And so it makes absolute sense for us to accelerate the process for the mining industry and an industry of that type to actually push ahead. Because they also are used to procuring this kind of vaccine. They run the HIV strategies, and they have their own health systems in many instances. They could really accelerate access to a wide swathe of the population.
Prof, I'm afraid we're going to have to leave it there.